The University of Texas Health Professions Office proudly presents a presentation on the pharmacy school interview. Up to this point, schools only know what is reflected in your written application. The purpose of a personal interview is a two-way street. Evaluators determine your fit. Likewise, you determine if the school suits you. This is also your opportunity to make a personal impression. This student is mistaken because, you see, you are being interviewed the whole time while at the school or on the campus. And there are lots of prepared activities for interviewing students. The following activities may seem more like events, but they are actually part of the interview. So it's important to keep your demeanor and behavior in check. The general sequence of events is as follows. A reception may be offered the evening before the interview, during which you can meet current students. General school presentations are offered and may include student panels or information on financial aid, student services, and more. Some schools may also include tours and provide you lunch where you eat with faculty and current students. This is also a place to shine. Finally, formal interviews are typically conducted in a one-on-one fashion. Most schools conduct two 30 to 40-minute interviews. However, some may do a multiple mini-interview format. Multiple mini-interview format is an interview system that allows you to be interviewed by several different interviewers at 6 to 10 stations. Each station is 8 to 10 minutes long. Each station will pose different questions or scenarios, such as ethical dilemmas or questions about policy, interactions with an actor, standard interview questions, tasks requiring teamwork, and essay writing. All of these stations allow you to demonstrate skills and qualities that aren't reflected in your written application. If you have questions on this type of interview, schedule a meeting to speak with a pre-health professions coach. There are two types of interviews, an open file interview and a closed file interview. In an open file format, your interviewers will have access to your entire application information, including your entrance exam grades, letters, and essays. Closed file interviews normally mean the interviewer only knows your name or has possibly read your personal statement. Never assume an interviewer has read your personal statement. This is your time to communicate your experiences. You are being evaluated on several different qualities identified in successful health professionals during your interview. Here we list many, though not all, of these qualities. Know your strengths and how you've developed them. Be able to verbally paint a picture of how you demonstrated them throughout your undergraduate career. Share your story. Preparing for the interview is a three-step process. First, do your research. Get to know the school by using the school's website as well as other resources such as students. Demonstrate this knowledge to your interviewer by preparing high-quality questions that show you are informed and interested in the school. This is also an opportunity to learn information that can help you make a decision. Don't ask a question the website could answer. It is important to demonstrate your knowledge of the profession. Know what kind of issues or challenges you would encounter when you are a pharmacist, all day, every day. Also, know what would be rewarding to you in this profession. Understand and be prepared to discuss current issues and trends in the profession. Step 3, review your application materials. Know what you've already communicated, but don't assume they know every last detail. You can tell a story you've already written about if you can add more depth and detail and new aspects to that story. Lastly, be able to articulate why you were a good fit for the school and profession. Talk about your past, but focus on the present and future. Mention relevant information about your background, then move into your present self. Talk about your major, school, activities, hobbies, and other experience. Then share your future goals and include information that helps the interview see you as a strong candidate for professional school. This is an opportunity to sell yourself. Don't ramble, especially about personal details, and avoid sounding overly rehearsed. Breathe. Behavioral style interview questions are common because past behavior predicts future behavior. An effective approach to these questions is the STAR method. Begin by explaining the context of the situation. Then talk about the task and your actions to accomplish the task successfully. Be specific. Finally, explain the result of your actions. If you have any research experience, be prepared to talk about it, particularly what you have done and what you have learned about the field and yourself. If it is related to healthcare, include that in your discussion. When answering negative questions, be honest. Take time to reflect and have insight into yourself when answering questions framed around weaknesses, mistakes, and failures. Tell your interviewer what you have learned as the result. Negative questions are intended to assess your character. Be transparent and give them the opportunity to get to know you. Now let's discuss the ethical question. There are no right or wrong answers to ethical questions. Interviewers want to see how you will think through, process, and evaluate different situations. These situations are often clinical scenarios. Provide evidence and a basis for any opinions expressed, and be honest about what you do and do not know. The interviewer may challenge you to see if you can substantiate your position and how you will handle it if you don't know the answer. Nonverbal cues are equally, if not more, important during an interview. You are making an impression on the interviewer about how you'll interact as a student in their community as well as with patients. Mirror the interviewer's tone, but still be yourself. Dressing appropriately for an interview means you should look professional. We suggest wearing a traditional conservative business suit with minimal accessories. Take extra measures to make sure you and your clothing look clean and in good condition. Be prepared to take notes, especially people's names. Also, bring a portfolio to hold your important items. You do not need to bring a purse or backpack. Turn your phone off and bring your questions for the interviewers, which should be typed. Remember to wear comfortable dress shoes for tours. These are logistics to keep in mind to make your interview day go smoothly. Try to arrive a day early to familiarize yourself with the campus. Get a good night's rest and give yourself ample time to get ready in the morning. Don't forget to eat breakfast. Lastly, arrive 20 to 25 minutes early. Now, go through our supplementary handouts. Do your research on the schools and current healthcare issues. Practice talking about your experience, knowledge, and quality.
Or you can schedule an interview prep appointment with a health professions coach. Good luck!